Hi, my name is Sarah Woods. I'm an assistant professor in the family therapy program at Texas Women's University. I'm going to talk to you a little bit about some research that I recently did with two colleagues looking at the connections between close relationships and health for adult family members. So in general, I'm interested in research on families and health and understanding the multiple connections between our close relationships and mental and physical health for adult family members. We understand these connections well for kids because we can think about how kids are embedded in their family and how parenting and attachment and those kinds of things affect kids' health. We don't understand that as well in the relationships and health literature for adults. And when we do look at close relationships and health for adult family members, we are almost always talking about marital relationships because we assume that marital relationships are the most important for adult family members. So our research is based in the Biobehavioral Family Model, which is a systemic biopsychosocial model originally based in the work of Mnuchin and structural family therapy. And it explains the connections between family emotional climate and biobehavioral reactivity, and that these two things influence one another, and if they are negative, worsen the physical health and disease activity of individual family members. So negative family emotional climate or negative family processes include things like negative relationship quality, hostility, criticism, emotional over-involvement, and so that when these things are happening in a family, the model explains that these negative family processes contribute to individual family members' levels of reactivity or their psychophysiological reactions, which include things like cortisol and biological changes in the body, reactions to stress, and emotional reactions like anxiety and depression. And so biobehavioral reactivity is actually the mediator in the model, which means that it explains at least part of the association that we see between close relationships and physical health outcomes, which means that when I experience negative family emotional relationships, I have more reactions to stress, more anxiety, and more depression, and that chronic reaction to stress influences my disease processes and that therefore worsens my physical health outcomes. Like I had said before, most adult research focuses on marital relationships. We assume it's the most important for adults, and more importantly, we focus mostly on marital status rather than romantic relationships or family defined more broadly. But what we had thought was that we know that the model fits for adult family members now, but that we still don't know how to incorporate both marital relationships and social support from family more broadly. So we decided to expand the biobehavioral family model and test it with both friend and family social support as an additional factor, because we know that from the literature social support is important to adult health, and so it's got to make sense as a factor in the biobehavioral family model. So we just hypothesized the same mediation relationship. We used secondary data from the National Comorbidity Survey replication and pulled a select sample of about 1,300 married individuals who answered questions about their marriages and social support. And we first did a factor analysis and confirmed that negative marital interactions and friends and relatives social support are unique, distinct factors. So they're not, we can't just clump them all together and describe them as the effects of close relationships, that they are different, unique factors, and so we went ahead and added them into the model and found that when individuals felt that their romantic partner was demanding or critical or unreliable or got on their nerves, they were more likely to have more symptoms of anxiety and depression. And these symptoms of anxiety and depression related to a greater number of chronic conditions and prescription medications that they reported having. In addition, we found that when adult family members reported that they could rely on relatives for help, or that they reported being able to open up to relatives and talk about their worries, they were less likely to have symptoms of anxiety and depression. So we confirmed that biobehavioral reactivity is a significant mediator in the model and explains the association between marital relationships and social support from relatives and physical health. However, we were surprised that we found that friends' social support was not a significant predictor in the model. So it may actually provide less of a buffering effect for anxiety and depression because it didn't contribute meaningfully to explaining biobehavioral reactivity in our tests. So we think that this means that you can't ignore support from family, defined more broadly than just romantic relationships for adults, and that says important things for family therapists, that this is a really important place where we can intervene, and that when we're working with couples, especially couples with a chronic health condition, that it may be important to not just intervene in the couple relationship, but also to think about how to intervene in the relationship with family members and relatives outside the marriage relationship. So thank you very much for listening to this video abstract. If you have questions or feedback, I would love to hear from you. Please contact me and get in touch. And thank you very much.